Decelerations. 1. Which of the following indicates a positive result in a contraction stress test, CST? A. Presence of 3 contractions in 10 minutes with no decelerations. B. Presence of late decelerations with more than 50% of contractions. C. Fetal heart rate accelerations with fetal movements. D. Absence of fetal heart rate variability. Answer: B. Presence of late decelerations with more than 50% of contractions. Rationale: a positive CST indicates fetal distress due to placental insufficiency, seen as late decelerations during contractions. 2. What is the nurse's priority when a non-stress test, NST, shows a non-reactive result? A. Repeat the test in 30 minutes. B. Notify the healthcare provider. C. Prepare for an emergency cesarean. D. Encourage the patient to walk around. Answer: B. Notify the healthcare provider. Rationale: a non-reactive NST suggests that the fetus may not be well oxygenated and needs further evaluation. 3. Which of the following is characteristic of early decelerations on a fetal monitor strip? A. They mirror the contraction pattern. B. They occur after the peak of a contraction. C. They last longer than the contraction. D. They are unrelated to uterine contractions. Answer: A. They mirror the contraction pattern. Rationale: early decelerations are typically benign and result from fetal head compression during contractions. 4. Which intervention is appropriate for a patient experiencing late decelerations during labor? A. Increase the IV oxytocin rate. B. Place the client in the supine position. C. Administer oxygen via face mask. D. Encourage the patient to push during contractions. Answer: C. Administer oxygen via face mask. Rationale: late decelerations indicate uteroplacental insufficiency. Oxygen, repositioning, and stopping oxytocin may improve fetal oxygenation. 5. During a non-stress test, NST, a reactive result is indicated by A. Decrease in fetal heart rate after fetal movement. B. At least 2 fetal heart rate accelerations in 20 minutes. C. Fetal heart rate variability of less than 5 beats per minute. D. Presence of fetal heart rate decelerations with contractions. Answer: B. At least 2 fetal heart rate accelerations in 20 minutes. Rationale: a reactive NST indicates good fetal oxygenation and neurologic function with accelerations in response to fetal movements. Now, number 6. What is the main cause of early decelerations in the fetal heart rate? A. Umbilical cord compression. B. Uteroplacental insufficiency. C. Fetal head compression. D. Maternal hypotension. Answer: C. Fetal head compression. Rationale: early decelerations are typically caused by head compression during contractions, which is a normal finding. 7. Which pattern on a fetal heart rate monitor is most concerning and indicates immediate intervention? A. Variable decelerations. B. Early decelerations. C. Late decelerations. D. Mild accelerations. C. Rationale: late decelerations suggest fetal hypoxia or placental insufficiency and require immediate intervention. 8. What is the primary purpose of a non-stress test, NST? A. To assess uterine contraction strength. B. To measure the fetal heart rate response to stress. C. To evaluate fetal well-being and oxygenation. D. To determine the length of labor. And C. To evaluate fetal well-being and oxygenation. Rationale: an NST monitors fetal heart rate patterns to ensure the baby is well oxygenated and responding normally. 9. The nurse notes variable decelerations on the fetal heart rate monitor. What is the most likely cause? A. Fetal hypoxia. B. Uteroplacental insufficiency. C. Umbilical cord compression. D. Maternal umbilical cord compression. Rationale: variable decelerations are typically associated with cord compression, which may occur during labor. A patient undergoing a contraction stress test shows late decelerations with contractions. What is the nurse's priority? A. Continue to monitor for changes. B. Stop the test and notify the provider. C. Encourage the patient to change positions. D. Increase the oxytocin rate to stimulate more contractions. Answer: stop the test and notify the provider. Late decelerations during a contraction stress test indicate fetal distress, and the test should be stopped immediately. These questions cover key